Subunit 1 encompasses the distal foot and toes. It has low functional demands, as for example, often toes can just be amputated. Flaps here must be thin and pliable, and be moderately aesthetic, as this area is visible. It was elected to save the first metatarsal phalangeal joint for this man that was exposed after an isolated crush injury. A thin medial artery perforator free flap was chosen, and conformed nicely to the remaining foot. Subunit 2 is the plantar forefoot. This has high functional demands, as it is a push-off point during ambulation. Any flap here must be thin, yet durable enough to withstand these stresses. There will be low aesthetic requirements, as the area is hidden in shoe wear. Following a forklift rollover injury, forefoot bone and tendons were exposed. An anterolateral thigh free flap was chosen, especially because it has a very long pedicle that allowed reach to the posterior tibial vessels proximally as the recipient site outside the zone of injury, and the patient even returned to his original job. Subunit 3 is the dorsum of the foot. There are no functional demands here to be met. Yet any flap must be thin and pliable to not interfere with shoe wear, and simultaneously be acceptable in appearance, as any deformity will here be obvious. Motorcycle accident avulsed all the toe extensors. A large anterolateral thigh free flap was selected for coverage. Reasonable coverage allowed him to return to riding. Subunit 4 is the plantar midfoot. This area is non-weight bearing, so there are no functional demands. However, any flap must be thin and pliable, and oftentimes only a skin graft may be needed. Since this area is hidden, aesthetics are unimportant. Following debridement of a plantar midfoot abscess in this diabetic, exposed bone required a thin anterolateral thigh free flap for coverage. Subunit 5 is the hindfoot. This has high functional demands needed for weight bearing. Any flap must be somewhat bulky to pad the calcaneus, and simultaneously durable, but the flap can usually be hidden from view. This degloving injury of the heel could not be revascularized. A large anterolateral thigh free flap could be wrapped around the calcaneus. He is able to ambulate with some modification of his shoe wear. Subunit 6 represents the bimalleolar region. Any flap here must meet moderate functional demands so as not to impede ankle motion. Therefore, it must be thin and pliable, with some concern for aesthetics, as this will be visible. Following open reduction and internal fixation of an ankle fracture, this patient never healed both the lateral and medial malleolar incisions with bone and hardware remaining exposed. A long, narrow, yet thin anterolateral thigh free flap was chosen to simultaneously successfully cover both the lateral and medial ankle. Some consider the anterolateral thigh perforator flap to be the ideal soft tissue flap, and it is also valuable for many foot subunits. As its long pedicle can reach proximal recipient sites, it can be of large size to cover the entire dorsum of the foot, or wrap around the heel with only moderate bulk in most Americans. Another perforator flap option is the medial artery perforator flap, which would restrict the donor defect to the ipsilateral lower extremity. It, too, can have a long pedicle to reach more proximal recipient sites. It is relatively thin even in the obese individual, so ankle motion, for example, will not be impeded, while allowing a far better aesthetic result than a skin-grafted muscle free flap.